Hello, my name is Antonio Torres. I am going to be discussing cost reduction in patient admission kits. This cost reduction in patient admission kits is going to be looked at heavily because the organization which I am looking at is currently looking at participating in the public health option for health insurance, which was recently proposed in the state of Colorado. I have selected 5 units from this organization to analyze patient admission kits in, and Matt Putman, the director of Central Supply Chain in the northern region for UC Health, has been kind enough to be my not only mentor, but a great source of information for this project. This project, again, as I stated, is to allow UC Health to participate in the public health insurance option program once that is initiated. I'm hoping that this project will also allow for better product utilization and decrease the amount of waste that our organization has. So as far as parties involved for this project, I think those that are most vested and have the most to say about this and will be behind this project are our senior management group, because they are going to be the ones who will be initiating participation in this public health insurance program as that time comes. Materials management, we're going to be looking at reducing costs not only on these patient admission kits, but there are a number of other surgical options we're looking at changing, and other changes that we're looking to make in the inventories as well. One group of employees who will probably resist the most is going to be the nursing staff and other medical staff, including physicians and surgeons, who may have to change from a supplier that they are unfamiliar with, or one that they have not used, due to using any particular one that they have chosen for years. I know some surgeons have used certain products for in upwards of 15 years. So this would be a big change for them. So again, senior management group will have to have that conversation with them regarding any changes. I think that constant communication with the senior management group, discussion and any updates will be best. For my portion of this project, I won't have to be doing any of that, but my director will. Departments, they need to be notified of any materials changes, special orders, back orders. They're the ones that use the product, so they're the ones that will be able to tell us if there is an issue with any of the changes that are being made. Patients aren't going to really have any input on inventory changes, decreases, increases, any of that. Their main concern is going to be ultimately their bill. Regarding the hospital and nursing staff, communication will be the same as it is with all the other departments. For me, knowing that I am a major player in patient care, that is what helps me to strive to do my best with this project, and knowing that it is a blessing in this journey that I'm on as a future healthcare leader. So what I plan on utilizing to define the goals of this project is the DMAIC method. This is a Lean Six Sigma method. Basically, I'm going to define the items which are in each admission kit. I am going to measure them by seeing how many of each item are in each admission kit and how many admissions we have per year. Then I'm going to use that and analyze the cost spent on items per year. And in order to improve, I want to educate hospital staff more thoroughly My hope is to implement a new employee training program at orientation so that employees can understand how the Kanban system works, and then utilizing a 30, 60, and 90-day review of the project would benefit, as shown by previous studies in other projects done in other facilities. Where I'm going to get a lot of my information from is Epic, which is our, sorry about that, I don't know why that slipped to the next slide there. Here we go. So Epic is our electronic health medical record that we utilize at, okay, this is being real fidgety now, I apologize. Sorry about that. Here we go. So again, Epic is the EHR that we utilize at UC Health. And I'm sorry, this thing just went all over the place. Here we go. One more time. Third time's the charm. So, with Epic, I'll be able to access, with the help of the proper employee who has access to the Epic, admission rates and numbers, so that I can focus on been spent for the year on these admission kits. And then the other program that we use is Lawson. That allows us to utilize the system as in the second picture there, which are the blue bins. They're typically blue bins, but these yellow bins are the same thing, where the units will store the where we in supply management store the items in their inventory, and then they utilize either from, this looks like it could be 3 different gauges of needles, or it could be that these are such a high rate of use that instead of using 2 bins they use 3, but I highly doubt that. I think it's just 3 different gauges of needles, but typically it would be, if it was these 2 here, this one would be used first, this one would be the backup. This one on the right would then move over to the left. Central Supply would take that one, fill it, and then move it onto the right there. So it's known as a just-in-time method, so that would help greatly with any expenses to see what is used in each admission kit. I think this knowledge, I can compare what's currently used with what we could propose is used less and only as needed, and this would be a great cost savings. One of the articles that I read was that a nurse in an outpatient surgical facility identified liquid waste and other surgical waste. She was able to differentiate to staff what should go into regular trash and what should go into medical waste, and if I recall correctly, saved close to $1,200 a month for her organization on medical waste charges. So time is money, especially in operating rooms, but time is money in all facilities and areas of a healthcare organization.